Ready to start the meeting here. I'm going to call the March meeting of the Albany County Legislature's Health Committee meeting to order. Good to go. Thanks. Pull up the agenda. Give me 1 minute here.
Right on time.
What I'll do is I'll have Rebecca Kennedy call the roll.
Sure, Mr. Chairman. Mr. Joyce?
Present.
Reedy?
Here.
Beston?
Here.
Collins?
Here.
McLean Lane?
Here.
Miller?
Present.
Moriello? Ward?
Here.
Willingham?
Present.
8 present, Mr. Chairman.
Thank you, Rebecca. Okay, thank you. Under previous business, can I get a motion to approve the previous meeting minutes?
Motion.
Motion made by Ms. Willingham, second by Mr. Miller. All in favor?
Aye.
Opposed? Unanimous. Under current business, number 2, authorizing an agreement with Boston Air for the purchase of 1,000 air purifiers for child care centers and daycares in Albany County. Tonight we have Commissioner Whalen and the Finance Chief, Mr. Ransom Moore. Thank you. Anybody hasn't met Mr. Moore yet? He's taking over for Shauna Witherspoon, I believe.
So I know I've come here a couple of times to talk about the ELC grant, and this is for us to have permission to purchase the 1,000 mobile air purifiers from Austin Air. This is for the expansion of the grant funding that we got to include child care centers and daycares.
Thank you, Commissioner. Any questions from the committee? Hearing none. Motion made by Mr. Miller, second, or a question?
I have a question if I can, Chairman Joyce.
Okay, go ahead, Mr.
I
Green.
wanted to make sure the
I got
committee had gone. So this is state money that the county health department will use to purchase air purifiers. Who gets the purifiers? How do you make that determination?
So what we did was send out a survey to all the daycares in the area, similar to what we did with the schools. Every school in Albany County, every daycare in Albany County was sent a survey to ask for their interest and indicate whether they would like to have a unit. So it's available to anybody that wants it, that falls under that, auspice.
So you got the survey back. Do you have some numbers on how this is distributed across the county?
I don't yet, but I can certainly get those.
I'd certainly like to see them.
Mhm.
Thank you. Thank you.
Question from Ms.
Okay,
Willingham.
I'm sorry, he may have asked the question I'm gonna ask, I didn't know, but I see here it says air purifiers will be shipped directly to the child care centers or daycares.
Yes.
All right, so do, you already have a list?
We sent out a survey, and as a result of the survey, I think a list is probably either in the process of being generated or has been generated. I haven't gotten up-to-date, as of today, information on that.
Okay,
But it was sent to everybody, just like it was for the schools.
okay, you said everybody. Okay, so what I would be interested to know, do we have any idea, you said, what was the number on the list? How many?
So the number, this says 1,000, so that I think it was sent to 1,000, and I'm not sure how many we've heard back from yet.
Oh, so you sent it to 1,000 daycare centers?
I believe that that is around the number. I don't know, Ransom, if you have more information on that. But I would imagine it was done within the finance division, that the number that was created was based on the amount of daycare centers that they estimated might be interested in them.
Okay, so,
Now, it wouldn't just be daycare centers, because as you recall, the first time we sent it around to the schools, and there were some schools that initially didn't want them. So the schools get another chance at deciding whether they want them, so it may go back to that part of, who was available to get the air purifiers before.
okay, so are they limited in size because it's child care centers or day cares?
Yeah, so I think that they would have to have that designation.
Say again?
I think they would need to have the designation of child care
Oh.
centers.
Oh, okay, but
Or
I'm
daycare
just, when I said the size, not all of them
Yeah.
are, are designated.
Yeah, I don't
for-
think this includes things like people taking care of children in the home.
Yeah.
It's not for people taking care of children in the
I don't
home?
think so, no.
Okay, all right. So I'd just be interested to see who comes back, who responds.
Yep.
And also to make sure that, that people actually understand what they have available, to them too.
Yes.
All right, so, do we have something on that?
I can get something on it for you,
I
certainly.
appreciate that greatly.
Yep.
Thank you so much.
Thank you, Ms. Willingham. Any other questions from the committee? Hearing none, can we get a motion to move?
Second.
Motion made by Mr. Miller, second by Mr. Ward. All in favor?
Aye.
Any opposed? It's unanimous. Give me 1 minute. Back onto the agenda. Number 3, amending resolution number 184 for 2019 regarding the tuberculosis prevention and control program, amending the 2023 Department of Health budget.
So this is a request to take additional funding from the New York State Department of Health used to support Ukrainian and other refugee populations that are coming into the county. And this will include testing for TB as well as, evaluation and treatment as these populations come into Albany.
Thank you, Commissioner. Any questions from the committee? Hearing none, can we get a motion to move? Motion made by Ally McLean Lane, second by Mr. Ward. All in favor?
Aye.
Any opposed? Unanimous. Number 4, amending the submission of a grant application to the New York State Governor's Traffic Safety Committee regarding the General Highway Safety Grant Program.
So this is another grant that we are renewing this year, and we've had for multiple years. And the focus of this grant is really to promote pedestrian safety, and that's through education, providing reflective materials and other education. We have staff that go out to do outreach on high traffic areas or areas that have been reported as having high incidents of accidents, and providing this education. It's also for public awareness and chiefly for education.
Thank you, Commissioner. Question from Ms. Willingham?
Okay, so I'm reading this, it says, promote safety by distributing pedestrian safety information at select intersections.
Yes.
What does that mean?
So what that means is they go out to places, and particularly on the Central Avenue corridor, because there have been reports of a lot of pedestrian interactions and problems there. They talk to people about the importance of where they cross and how they cross.
Who? Who's doing the talking?
Our staff. We have staff that go out. So this does partially cover the staff. They also provide them with reflective materials so that, I don't know if you've seen the armbands, they're kind of slap bands that show, that would reflect a car's light, and sometimes they hand out vests as well. And they interact with a specific number of people over time for the grant.
Thank you.
Any other questions from the committee? Mr. Ward?
I see that this is, you mentioned the target is the city of Albany and Central Avenue, which we all know there has been several tragedies on that road, but also Route 9 in Latham, a little bit outside my district, but I know there has been. Is there anything being addressed about that as well?
So there certainly is availability if there are concerns within municipalities surrounding the city to do this work. This is mostly focused under the grant. They utilize a database called CLEAR, which is talks about where the highest prevalence of accidents are. But if there's any interest in other areas of or municipalities, just give us a call and we can work with you.
Oh, okay, very good, thank you.
Any other questions from the committee? Hearing none, can we get a motion to move?
Motion.
Motion made by Ms. Willingham, second by Mr. Beston. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Thank you, Commissioner. Mr. Moore? Next up is Dr. Giordano. How are you tonight, Dr. Giordano?
Good evening, Mr. Chairman.
Number 5, authorizing an agreement with the New York State Office of Addiction Services and supports regarding the New York State Opioid Settlement Fund.
Yes, thank you for the opportunity to bring to you some, I think, very good news. You all know that we're in the midst of a long-term heroin and opiate epidemic, which is transforming itself into a fentanyl crisis. And we've all been hearing about the settlements that have been made across the country. Well, the New York State settlement funds are starting to flow. There are three basic ways that funds are becoming available to the counties. Two of those are through the Opiate Settlement Fund. Oasis is the recipient of $126 million this year. Mind you, this is going to be a 16-year rollout, so this money is going to be available and flowing for 16 years. In the Oasis monies, there is going to be $126 million that goes out to the public through RFP, through program development, through new initiatives, and $64 million that is direct to regions and counties. I'm coming to you tonight to ask your permission to accept the first allotment of the Opiate Settlement Regional Abatement Funds direct to Albany County in the sum of $1.573 million. This is for the first 2 years. The Opiate Settlement Board got started a little late last year, and so this portion of what Albany County will be getting over 16 years is covering 22 and 23. Next year's and subsequent allocations will likely not be this high, but it will be significant for the next quite a few number of years. And we anticipate a budget amendment request to be forthcoming, not this evening. Part of what we're doing is trying to set up a separate line with the controller so that we could kind of keep this money independent of the funds.
Okay, this money, we're just accepting the money tonight. We're not.
Yes, sir.
Anybody that applies has to go through the RFP process.
Well, so that's a good question. We are starting a process where we're working with local community stakeholders as well as Department of Health and Department of Mental Health to identify those kind of projects and priorities that we have been wishing we could attend to in the recent few years. And I'm hoping that soon there will be a process for stakeholders in the community to apply for that as well. And we would go through the county procurement process for that.
Do you have any questions from the committee?
Dr. Giordano, what type of opioid combative programs do you see this money going towards?
Well, I had the good fortune to, I still have the good fortune to be sitting on the state opiate settlement board. And the counties are being asked to look to the board to kind of prioritize this money. And one of the things that we identified at the state level, which I think is a good start in answering your question, is to look at the first year or two as almost like rescue funds to try to get as much life-saving, direct care projects out on the street and to include things like flooding Narcan wherever it might be needed, working with local emergency services to make sure that everyone has that. Beyond the life-saving part is prevention, education, treatment, all of the pieces that go, that, we have a rich system in Albany County that many of you have heard me talk about, rich in terms of many services, but it's only the tip of the iceberg. So, what I would hope to see is that we're able to duplicate the programs that are working and to increase the presence throughout the county. I think prevention education is going to be a long-term goal for us. But again, working, this has from the beginning been a partnership between health and mental health, and I think both of our departments are currently involved in a number of projects that we'd like to see continue.
Are legal injection sites talked about? Are they on the radar?
They are talked about. Would you like
Can
to
you
tell us?
elaborate on that?
Well, so here's the thing, and this is like the third rail. This is, you touch this and it's at the state level, the board of 21 members from across the state, we recommended that OASIS and the governor's office consider safe injection sites after hearing testimony and hearings from people from all over the state. we made 200 recommendations at the state level. 2 were rejected, that was one of them. And it was rejected because it is federally not legal, apparently. Problem is that, and what is still a curious, I think, observation, is that New York City is running 2 of them, and the mayor wants to do 5 more, and I'm not sure if it's illegal how they're doing that. So there is interest, I think, across the state. I have been part of some discussions locally about what the implications would be for that. I know of no plans to push that forward, though. I think that's going to be a multi-pronged kind of thing.
I know we've had some issues with the methadone clinic.
I know. I know. I mean, that is a wonderful discussion to have it beyond the scope of tonight, but I think there's very interesting evidence on both sides of this. I mean, caution would be the prevailing, recommendation, but lives are being saved in New York City. So, but it's a law enforcement issue, it's a district attorney issue, it's a health issue, it's a licensing issue, and apparently a legal issue still. So, but they're doing it all over the world.
Thank you, Doctor. Do you have a question from Ms. McLean?
Yes, please. I do have a little bit of knowledge about I did watch the opioid settlement board discussion on these harm reduction sites. One of them is that the New York City Police actually are highly supportive of them.
They are.
Because they can drop people off there. And the other thing is they've saved numerous lives from the testimony that we heard. But in addition, that is a route to get people to treatment.
All
Because
true.
they are able to discuss it with them, they're able to stay here, et cetera. But they've saved numerous lives. And of course, they're also talking about having the drug testing machines in some of those locations as well. So people can identify what is in, especially with xylazine, I think is now the big problem in addition to
Well,
fentanyl.
it's a growing, scary
I
problem.
should say. I had one question. This local government unit, which is something I just learned about 30 minutes ago, for Albany County, what is that specifically?
So it's interesting because that's the Department of Mental Health.
Okay.
There are 57 of us across the state, and they're identified through OASIS as when I come to you in the fall with dozens of local contracts, pass-through money, the state passes through money through the Department of Mental Health. It's the same in every county. We're the local governmental unit for OASIS.
I see.
And the settlement fund, as it was written by the Attorney General, the money, wherever it's going to come from, the different
Got it.
litigation, it goes to OASIS,
Mhm.
and they're distributing it to the local governmental unit for us then to work with the community, the county exec's office, the
Got it.
legislature. So this is being replicated across the state, different amounts, of course. And, there was a formula why we got the money we did, and they're basing, again, from the recommendations from the state board, that there be a focus on mental health, focus on equity, inclusion, and diversity. And so the formula that gets to this money, dollar amount, is number of suicides in your county, number of fatal overdoses, and the minority populations relative to the overall population in that
Yeah.
locality. So
Yeah, and I also like if you, just for education of all of us, I guess, what was wonderful about the opioid settlement fund, as it was written in statute, is it identifies exactly what we are allowed to spend these funds on,
it does.
which is, it defines what the role the county has.
There's a lot of flexibility
Flexibility.
within a certain
A
lane.
box, yeah, that's exactly, and I just on may I just speak to you after this, very briefly?
Of course,
Just with your thing.
just don't yell at me.
No.
Do you have any other questions from the committee? Yeah, then can we get
I have a question, Chairman Joyce.
Go ahead, Mr. Brown.
Just to be clear, is there anything that prohibits using this opioid money to buy needles for addicts? Yes or no?
I don't know the answer to that.
Right, I think that's an answer I'd like to see.
Well, the approved uses and the eligible uses are very clearly written, and the at them together if you like. I mean, I just don't know.
'Cause I think,
And
what
one of
I'd
our-
like to see is that there's so much need for treatment. That's where I'd like to see the money go.
Well, one of our most successful programs, I will tell you, and again, this is, you know, you could argue both sides of this, but for many years, the needle exchange program that's run by Catholic Charities, as again, as a way to engage people who are otherwise going to not get into treatment today and are going to die tomorrow. We do give needles to people. I don't, but I mean, there is a program in this county that does. And I'm sure that that program will be applying for more money, whether it's for more needles, I don't know.
At this time, we're just accepting the money.
Yes, just accept.
Ms. McLean-Lane?
One really quick thing, and something else that has come up that I think would be something larger, is that I recently learned from a constituent who's very concerned that Albany County is one of the highest levels of STIs in
Say
the
what?
state, sexually transmitted diseases,
Oh,
on
okay.
STDs in the state. And obviously, needle exchange programs are extraordinarily helpful for the transmission of
I don't doubt you,
diseases.
but I would defer to Dr. Whalen to know about that.
No, but just comment.
Yep, yep.
Do we have any other questions from the committee or any other member of the legislature? Hearing none, can we get a motion to move? Motion made by Mr. Besson, second by Mr. Miller, all in favor?
Aye.
Any opposed? Unanimous.
Thank you very much.
Number 6, amending resolution number 465 for 2021 regarding workforce development funding from the New York State Office of Addiction Services and Support.
So this is a request to approve this extension of a workforce development grant that will allow us to provide training to our workforce around addiction issues. So it's kind of interesting that these both come up in the same presentation. For reasons of slow distribution at the state level to not being able to find trainers that were adequate to what we were looking for, we were able to get an extension from OASIS for 3 months, and we think we'll be able to get our training done in the coming 3. We ask for your approval of a no-cost extension of this grant, $8,500.
Excuse me, any questions from the committee? Hearing none, can we get a motion to move? Motion made by Ms. McLean-Lane, second by Mr. Miller, all in favor?
Aye.
Any opposed? Thank you so much, Dr. Giordano. Can we get a motion to adjourn?
Motion.
Made by Mr. Besson, second by Ms. McLean-Lane. Favor?